Welcome to Heartbreak and Hope with Pat Barbarito, the show that explores how to build up or break down any relationship with confidence, clarity, and compassion. For years, 43, I've seen people come through my office with tremendous heartbreak, not consolable. There's nothing that I could say to them or do to them that's going to help them feel better. And that led me to think about it. What do people do to make themselves feel better? How do you feel better? Is heartbreak something that can be improved by paying attention to our looks, improving our looks? And when I got to thinking about that, I turned to my friend, one of the foremost authorities on cosmetic lasers and non-surgical procedures, Dr. Mitch Chasin. Welcome, Mitch.
Thank you. Thank you.
I do have to say, full disclosure, the real reason I wanted you on, because this is one of my favorite stories with you. I confess, when my own marriage ended, I don't know if it was 10 or 13 years ago, I've lost track. I would have done anything to feel better. Just, I wanted an immediate feel better. I wanted somebody to wave a magic wand. And I found Dr. Chasin and made an appointment with him. And he basically said to me, yeah, no. I said, what do you mean? He said, yeah, I'm not going to do anything. I said, well, you got to do something because I want to feel better. And you essentially said to me, no, you got to work on whatever's going on and then we'll talk. And that was shocking to me that anybody would do that. So let's start with that. What would make you say that to somebody, and why would you say that to somebody when they came to you because they wanted an immediate fix?
It all starts with expectations and really talking about our field in general. And people view our field as an external field where we're trying to help someone look better. And the truth of the matter is, we know that when people feel better about the way they look, they feel better internally. So we want the treatment, whatever that is, whether that's non-invasive, minimally invasive, invasive, whether that's on the face or the body, we want it to be successful. When it's successful, there's an immediate transition in how people view themselves. And when they view themselves better, there's a transition in how they treat other people, how they treat themselves, in terms of looking for other mates or looking for new job positions. I mean, just a radical change in the quality of life. So we want those treatments to be successful. And in a situation where it takes some engagement on the patient's end to ultimately give us together a better result, then that's the way to go. Unfortunately, people oftentimes, they don't want to hear that. They want an instant fix. They do want that magic wand. And sometimes we need to delay that magic wand to achieve the ultimate result.
Well, that was shocking to me. And I had unbelievable respect for you because you could see that what I was looking for was just something to get me out of immediate pain. And somehow I thought Botox would do that, which is just an indication of, the fact that I wasn't thinking clearly. And you recognized that, and you were very kind to me. And you saw that I needed to work through some issues, and you were 100% correct, because studies do show that being more physically beautiful does have an impact on happiness. I was surprised by that because, we all hear that happiness comes from within and happiness can be achieved on so many levels. But the truth is, physical beauty does have an impact on happiness. That was a surprise to me.
Yeah, and it's not just physical beauty. That certainly has an impact on the way we feel about ourselves and about life. But very often, people, both women and guys, spend their lives answering to others, whether it be to a spouse, whether it be to their kids, to their employer. And just being in our office, sometimes just that very fact they're in our office, and that's a decision they made, and they're sitting here untethered and doing something that makes them feel better, that's a gigantic positive in itself. And sometimes, if we make people wait too long, they're not happy. And sometimes if we don't let them wait long enough, they're unhappy. When they come in the room, they're just trying to settle in and no one's bothering them, no one's calling them, no one's tugging at them. It's a time to relax. It's a time to release. Just the very fact that they're doing something for themselves is very often a very, very positive thing and leads them on a course of feeling better in general.
Isn't it funny that sometimes just saying the words, I'm going to do something for myself, I'm going to change my hair color, get some Botox, get a new outfit, that in and of itself lifts our spirits, right?
Absolutely.
It's a miraculous thing about mental health and physical beauty, but it strikes me that there are many, many variables to dealing with the issue of non-invasive or invasive cosmetic procedures. I mean, don't we have to look at, anxiety, depression, many other variables? I'm wondering how you incorporate that into your practice or your approach when people want something more radical than just Botox. How do you address that with somebody when you
Right.
see maybe there's some mental health issues going on? And I would imagine that's not so infrequent.
Yeah, unfortunately, it is very frequent. I mean, we know that mental illness is pervasive in our society today, and most people suffering from it don't voice it. They don't articulate it to others. And after 26 years in cosmetic medicine, I can open the door to see a patient and look them in the eyes, and their eyes tell a story that they aren't feeling good about themselves. And, sometimes that's a lot deeper than other times. What's interesting is even something like Botox has been shown to affect someone's spirits, their mental state, independent of the way they look. There have been countless number of studies done now that show that after a person undergoes a Botox treatment, that if they do have depression, if they do have anxiety, these symptoms improve, and they improve independent of the way they look. These studies were done and patients consented and agreed not to look in the mirror. So not to look at what the effect of the Botox was. These were placebo-controlled trials, and the results were incredible. It showed us directly that having the Botox done itself was something that improved someone's spirits. And they started to look and understand why this was. And one of the reasons is there are certain mannerisms that a person does when they're under stress, when they're depressed. They may frown, they may scowl, there are different things. And when we decrease their ability to do this to some degree, there's a feedback loop right back to the brain that says, well, if I'm not scowling, I'm not frowning, I must be feeling better. And you start to feel better. And this has been shown again in multiple studies. And to the point where they're finding that Botox is as effective as many of the antidepressant and anti-anxiety medicines. Again, this is independent of the way we look. It's pretty incredible.
That is fascinating to me. So if we can't scowl, we can't frown, we can't, furrow our brow, there's something about the mind that says, okay, you're not doing that. Therefore, you elevate your mood. That's fascinating to
That
me.
says you must be in a better mood because you're not doing that. Exactly. Yep.
Wow.
And as
So
that wears, it's interesting, some of those symptoms start to return.
that's wild. So, Mitch, you go into a room, you have a patient there, you're a great reader of people. I know that just from my friendship with you, but you see somebody and you talk to somebody that really has deep rooted issues, but wants a fix. How do you address that in a respectful way, in a way that's not going to insult somebody, but not going to offer them false hope? What do you do? How do you
Right.
handle that?
So the first thing, it's interesting, I do teach courses on consultations, cosmetic consultations. And one of the first things we teach when you enter a room is not to converse about the reason the patient is there, but to talk in general. Patients that are under stress, patients that are depressed, patients that, have issues that are partially behind the reason they're showing up, they tend to articulate these fairly quickly. And you just see once you enter these conversations and talk about things in general, their shoulders, they go from up near the ears to down. Their legs uncross, they start crossed and pointing away from me, and then they cross pointing towards me. They swivel their chair to face me. Their head lifts, their eyes open.
Hmm.
And so just articulating, just the very fact that they're talking and talking about things in their life, possibly things that bother them and things that are troubling them, that in itself is cathartic, and it starts the program of healing. So I try to focus on those things before talking about the aesthetic of why they're here, or what they want to fix, or what they want to tweak. And I think that's one of the the goals is tapping into those things, because ultimately, what's a measurement of my success? Measurement of my success is having a patient leave my office, whether or not I treat them, feeling better about themselves. That's my goal. And even if I don't treat them, I want to have them leave feeling they're a better version of themselves. And sometimes that even happens just from talking.
So I would have never thought about the fact that there was an art of the consultation in your field. I know in my field, the divorce world, there is also, because there are people who come in who have obvious mental health issues, and getting a divorce isn't going to fix them. And I feel an ethical obligation to explore what's going on with them before just saying, let's file a complaint for divorce. But that seems more obvious in the divorce world than it would be in the cosmetic procedures world. I would have not thought of that.
I think that is one of the things that distinguishes practitioners in this field. And I think if one is good at relating to someone and picking up on these sometimes not so subtle and sometimes subtle cues, then that distinguishes that person. And that's what leads to loyalty. That is one of the things that keeps a patient coming back. And I think with that comes a trust that we understand that patient's needs, and that may be described as a wrinkle on the forehead or a contour of the cheek or chin, but that's not really, that's not where the money is. The money is really feeling better about themselves, and that wrinkle on the forehead just may be a physical thing to tweak to trigger them feeling better.
What's fascinating to me is the money that you or someone like you might make as a result of that individual patient is not worth the reputation you will build by being honest with that patient. And I go back to myself, forgive me, but when we had that first meeting and you asked me, are you going through something? I said, yes, my marriage ended. And you said, yeah, you have to deal with all that. And I remember thinking, wow, never occurred to me to really think of like that. And after that, God knows I've probably sent you anybody who will listen to me. And of course, eventually I went back to you. I get Botox. It's not a big secret. And that built loyalty because I trusted you. That was something that you cannot advertise for. That kind
Yeah,
of loyalty. You can't, because you don't trust somebody. I'd like to do that in my own business. I like to say to people, yeah, I can't divorce you. You need to do this, this, and this, or you need to go back to marriage counseling. But I think loyalty is more important to us as professionals, both from a business and reputation point of view, than any one client or patient you may get.
absolutely. Unfortunately, in our world, when a patient comes in and they really have their heart set on something and it's not right for them, they're very disappointed in being told that that is not a good choice. I will tell you that if I get a bad review, 99% of the time, it's for me turning someone down because not everyone is as insightful as you and really looks at that deeply and understands the rationale for not moving ahead with something, or at least at that time. So it is disappointing. And that's why I think trying to build loyalty with that patient, even if it's the first time you've met them and you're trying to build credibility with them, is really critical. And it's probably the reason I also have a lot of gray hair, because it is really difficult to turn someone down and say no, or at least no, not right for now.
How do you manage expectations? Because people, it's kind of like, the old joke, you go to your hairdresser with this picture and I want to look like this person who's 30 years younger and has got blonde hair. You just don't come out looking like the picture. So how do you deal and manage people's expectations?
The first step is understanding someone's expectations. And that comes from verbal and nonverbal and sometimes manual kinds of cues. A patient that is concerned about their looseness in their skin, and they're concerned that their face is drooping, it's dropping, and they're starting to look like their mother or their grandmother. I may say, well, tell me what will make you happy. And patients will use terms like, I want to see this gone, or I want to see this fully go away, or I don't want to see this anymore, rather than I want to see this improve. So verbally improve versus gone, speaks to two different levels of expectation. The next thing, that person may take the hands and lift the sides of their face all the way up to the ceiling and say, this is what I'm looking for. And that's an expectation of perfection. I may ask them on a scale of 1 to 10, what kind of result will make you happy? And they may say, if I don't receive a 9 or 10, I know myself, I won't be happy. And these things help us determine what mode of treatment may be best for them. There are non-invasive treatments where there's no downtime. They're very easy to do. The patient's in and out. They go right back to their life, all the way to surgical treatments. Well, a surgical treatment may be the only thing that can give that patient that precision 10 over 10 outcome. However, they don't want to do something surgical at that point. They want to do something non-surgical. So they may have the expectation of a surgical result, but want to do a non-invasive treatment, which certainly is going to give them improvement, but it may not give them a 10 over 10 result. That's something we deal with day in and day out and try to understand. I call them what someone's buttons are. What's important to that person?
Isn't it hard when somebody comes to you and says, look, I had this done, invasive or not, and I don't look how I thought I was going to look? How do you approach that? Because some people just want work done because they want to look better, feel better. Other people want it done because they want to heal some pain. The motivations are varied. But how do you address someone who doesn't come out and look and feel, critical word, how they thought they would post procedure?
The first thing is trying to avoid treating that patient who has an unreasonable expectation for the level of treatment that they want to undergo. So it starts with picking up on those cues. Sometimes we miss those cues and we go ahead and do a treatment that may not be as aggressive or as invasive as a person needs, and they're not happy, or it may be something that we do a treatment and I and the staff we're jumping up and down about the level of result, and the person is not happy. And we'll say, well, show me what you're unhappy about. And I'll try to hand the person a mirror, and the person will refuse and say, I don't look at myself in the mirror. I'll say, well, let's look at a before and after picture, on my iPad. And they'll say, I don't want to see myself, So they're giving us cues that this is way more than skin deep, this issue. And so we start talking more about things in general and trying to shift away from the physical before and after, because we know that's not what's guiding their happiness there or their contentment with that result. And it is a challenge. And very often these individuals, they need help beyond the aesthetic help. They need support, they need counseling. And, sometimes they know that, and very often they don't know that. And it's a very tricky thing, but I will spend time and be very direct about this situation, saying, if a patient is not willing to look in the mirror, to look at the before and after pictures that, we're actually excited about, there's something else going on. There was a person last week I saw like that. It's an incredible before and after picture. And the person said they didn't see anything and they didn't want to look at the before and after picture. And I said, and I feel bad that you're not happy. I said, and we'll do whatever we can to make you happy. And by the way, can I use your before and after picture on our website? Because it's so good. It's not just about the physical image. It's very often about what's going on internally.
In your teaching or in your lecturing, and I know you do a lot of appearances, television and otherwise, it sounds to me that what you're tapping into, and I think in many ways, many professionals miss this, is sort of a holistic approach to treatment. And I go back and forth with the divorce world that I'm in, because I think that it's very difficult to stay in that narrow lane of our disciplines and our profession without realizing there are other levels to it. So it sounds to me that what you're talking about and the way you approach treatment in your patients is sort of with a holistic approach, mind, body, spirit. I think that's something people wouldn't think of when they're thinking about going to get a cosmetic procedure. So, can we talk about that a little bit?
Yeah, absolutely. I think it is a combination. When I've gone to Canyon Ranch a few times, a health spa where you go in and you exercise and eat right and you're just taking care of yourself. And, the moment you cross the doors, you feel better and you haven't lifted a weight, you haven't eaten it well yet, you haven't done anything, but just crossing the threshold into that center, I feel better, body, mind, and spirit. It is definitely a holistic approach, as you mentioned, without a doubt. Some of my favorite patients are patients that are either contemplating or going through a divorce or have been recently divorced because, very often they have an altered self-image. And very often they're the prettiest people on the planet, and they come in and they just can't look at themselves and they just feel like they look horrible and they look older and they look angry and they look this and that. And when you look at them, they actually look pretty damn good, but they don't feel good.
You know,
And
that's a great observation that you're making, because I see it all the time too, that people who have been heartbroken, who have been devastated emotionally, and I'm not blaming anybody because it does take two to work through a relationship, they feel ugly. So it's got very little to do sometimes with the reality of their physical appearance.
absolutely. These people, they come in very often, they're asking for a litany, a laundry list of different things to be done. Yeah, I want to work on this and I want to work on that. And I want to lift this and I want to change that. And, I try with these people to do as little as possible because just the very fact that they're doing anything, you see their spirits lift almost immediately. They walk out after having something done and already they're feeling better, and they talk about this and they write thank you letters and all this stuff, and very often they're feeling better before the results of that treatment actually are kicking in. Of course, I'm not going to tell them it takes 2 weeks to kick in because
Yeah.
they're feeling better at 2 days, but the very fact that they are treating themselves, that they're doing something for themselves, is often a new feeling for them, and one that just heightens their spirits, and it's one of the most satisfying things to take part in.
So, it's interesting. So they come in with these heartbreaking situations and they look to you for their hope. I think one of the things that I've seen in your practice is there's a lot of kindness that goes on there, And I think that sometimes by just treating people kindly, it does make people feel hopeful. It changes their whole mindset. Is that something you do consciously, or you train your staff to do consciously, or is it just innate to the profession?
I think it's a little of both. I think there are some people that naturally it's more innate and they pick up on those cues, and other people it's a learned skill. So when I train clinicians to do consultations, there are things that we're training them to do to try to pick up on those cues, especially if it's not an innate skill, which it isn't for everyone.
Some people might say some physicians aren't capable of having a good bedside manner. That's not an unheard of statement.
I think that is true, but I do think that most physicians, they're smart enough to understand the need to pick up on those cues, and they can learn the skills necessary to do that. I just gave a course last week where we spent an hour just talking about those cues and how we pick up on them. Basically, as with any procedure, we say, well, what's the end point of that procedure? And what I explained to them is the end point of that procedure is improved self-image and improved self-confidence. And the condition that we're treating, is one where the patient just doesn't feel great about themselves. And it may be disguised as them just not feeling great about the way they look. The middle part is easy, right? It's the
Yeah.
beginning part and the end part. Those are the key things, though.
So statistics tell us that women make up 92% of the people who get cosmetic procedures.
That's the first thing, as long as I've known you, I think
Yeah.
that's the first thing I disagree with.
Good.
That
Tell me
that
about it.
that
I mean,
number
I listen,
that
I read it in one of the journals that I've been sort of researching for our talk, but I'd actually love it if that was wrong. That would
that
make
is
me happy.
wrong. That's
Great.
old
That makes me
data.
happy
That's old data.
because that's 2020 data. So I'm happy that that's wrong because I thought that was really disproportionate.
Yeah,
What is
no.
your understanding of that?
It's in the low 80s basically.
Really?
And every year the number of males that are coming in for treatment continue to climb, and they're doing everything that females are doing.
So
And
what is that about? Do you think that women do it more as a result of a divorce or heartbreak situation or age, and men do it more because they want to just look good? I mean, is there a difference in their goals, desires, and reasons that you see?
I see many men coming in because they want to be able to better compete in the workplace. But very often it's during a situation where they don't feel great about themselves socially,
Hmm.
that they have undergone a divorce and they're now, out online and swiping left and right, or have, just broken up with a girlfriend or boyfriend, and are just not feeling great about themselves. So I don't think it's very dissimilar to a female in terms of what drives them there. I think females are just more verbal about talking to friends about what to do and where to go and how they like that treatment. I think guys are just, they're not at that point yet where they're as free to talk about things.
Being a woman well into my 60s, as you well know, and being somebody who entered the dating world much later in life after my marriage ended in my 60s, I speak with a lot of women in particular, and many times I hear, well, I'm not ready to date. I got to lose 20 pounds. I have to get some Botox. I have to get a neck lift or a facelift, and that will get me ready to date. Now, I routinely will say, I promise you, you're never going to be ready to date. So just do it. But do you see people who come to you and say, if I do this, if I check this box, if I do this, then I'll be ready to meet somebody? And how do you react to that when they share that with you if they do?
Yeah, they share it on a daily basis. And my response to them is that they deserve to be out meeting people, exploring new relationships. And if these procedures make them more amenable to opening up to do those things, that's terrific. But it should not be the reason that they make a decision to meet new people and to explore these new really incredible possibilities. So that should come from within. That should come from the heart. On top of that, if these things can give them a little nudge and make them feel better and be an impetus at times, nothing wrong with that. But it's not where it should come from. It
Yeah,
really should
because
come from within.
well, this makes me a little bit crazy because especially with women in their 50s and 60s, like if somebody's not going to date you because you have a few extra wrinkles or 20 pounds, I got to tell you, that's a problem. I get very frustrated. I have a lot of friends. We talk about this and I say, listen, you could kind of improve along the way. But if somebody's not going to go out with you because of this or that, that might not be a person that's a good mate.
Correct. And it's more about you than the other person, is what I explained to these individuals. And I said, if you're talking about meeting, dating, getting engaged, whatever it is, getting remarried to an individual who has concerns about you because of that wrinkle or the frown lines, that's probably not a person you want to enter
Right.
a relationship with in the first place. So your concern about those things is really more about you than it is about the other person. I try to counsel them to kind of give themselves a break. And we find that very often people, at least in our experience, people that are going through or have gone through divorce are just the hardest people on themselves that you can find.
Absolutely.
And part of my goal is to make them feel better about themselves. If we are going to talk about an area that they want to tweak, the first thing I talk about are all their positives, or all their attributes. And when you start complimenting them, again, you see this immediate sense of relief, of feeling good about themselves. We all are critical, but I just find that subset of people related to divorce are super critical, and they need to be told the truth. And I will tell people like it is, positive and negative.
Oh, yeah.
Our patients that walk in that don't look great, don't look as good as they normally do, I'll tell them that. And by the same token, when they walk in and they look great, as most of the times they do, I'm telling them that as well.
So beauty comes from confidence. And when you feel confident, you act confident. And I think you're able to let people into your lives. Um,
Absolutely.
I read in some of my research that one of the most commonly associated mental illnesses associated with the need or desire for cosmetic procedures or plastic surgeries is body dysmorphic disorder.
Yep.
So, can you talk to me a little bit about this disorder and the fact that people have a preoccupation with perceived flaws? Are they real? Are they not real? And does that impact how you give somebody hope in your work?
I talk about body dysmorphic syndrome as well as facial dysmorphic syndrome.
What are
And
they, first of all?
and they are situations where what a person's physical condition is not congruent, does not match the person's evaluation of themselves. So they may see something in themselves that is just honestly is just not true, is not there. And we talk about beauty being in the eyes of the beholder. However, there are objective signs of beauty as well as subjective signs of beauty, of course. But these objective signs of beauty, they may be there, or they may not be there. And very often, the most beautiful people in the world will view themselves in such a negative light, and they see themselves so differently than what the mirror says or what anyone else, how anyone else would view them. And they view themselves as having, even when we talk about particulars on the face, about the eyes or about the cheeks, about the chin, they pick themselves apart and they say their chin is long and their cheeks are flat and their eyes are small. And you look at this person and they have the most beautiful contour of their cheeks. They have big, beautiful eyes and a flowing chin. And like you look at them and go, my God, they're a 10 over 10. But they don't see themselves like that. They see themselves as a 2 over 10 or a 0 over 10. And that's dysmorphic. It's not congruous with how they really are and how someone else would view them. And that happens both for the body as well as the face. And we know that from anorexia and bulimia that people just don't view themselves like they really are. And these are people in the aesthetic world, honestly, that we have to be very careful in deciding whether we want to treat, because typically these are people that are never going to be happy no matter what you do, and people that really need proper professional counseling to deal with these issues. Because if the reason they're not happy is a physical malady that is not real, fixing that malady is not going to make them happy. And if anything, may frustrate them even more, because now they've spent money, time, and they had the hope that for once they were now going to be happy because they fixed that malady that wasn't really a malady. So it is a common thing that we see,
Yeah.
and something that we look to pick up on right from the beginning of the consult if we can.
I've read it leads to a cycle of wanting more, wanting different, wanting continuous tweaks. And when you see that, do you just say, yeah, I can't do this. I'm not doing this. Or do you say, look, you need to talk to somebody because you have perhaps a disorder? How do you tell somebody that?
Yeah, there's not a day that doesn't go by that we don't see someone that has that
Wow.
issue. And the number one thing I try not to do is miss it. And if I pick up on it, I try not to treat that individual, because I just know I'm not going to make them happy, and it becomes frustrating for them. And if I do treat them and they are happy, there's someone that is going to want more, because if a little makes them happy, that means a lot is going to make them happier. So there are people that get caught up and they want more and more and more, and they don't want to be told no. And if you tell them no, it's a very negative thing. It tarnishes the relationship and it makes people very angry. So it's honestly better to tell that person that this is not what they need. It's not, an issue that should be treated, and not a procedure. If they're interested in something that is indicated here, it's not going to get them to an endpoint that they desire. It's an area that is so common, and an area that there's just not enough counseling for today. And it's a critical area.
So when we started out thinking about this episode, I realized people think of cosmetic procedures or cosmetic surgery as there's a problem, you fix it, a medical situation. But as we speak, I realize there's so many layers and so many variables to the decisions, the recommendations, the course of treatment. And I don't know if the general public understands the nuances, for lack of a better word, involved in treating somebody who wants to kind of look a little better or fix a heartbreak or feel better. And you certainly enlightened us about that issue. And I'm grateful for that. I really am, because I think it's very important that people understand it's not just a needle or a knife. It's a complex issue. And
Absolutely.
I think
And
you give a lot of people a lot of hope in that regard.
and I think it is something that is a very positive thing for people. It doesn't mean people need to spend a lot of money or a lot of time, a big investment in themselves when it comes to aesthetics, but it is, I think, one of the possible things that people can do to help heal themselves. And though we talked about divorce, we haven't talked about bereavement. We haven't talked about when spouses, lose someone, or when someone loses a family member. There are similar kinds of thoughts that these circumstances trigger, and they very often wind up in situations where people just don't feel good about the way they look. And again, underlying it is something completely different than looks. It's about,
Hmm.
that situation. So again, helping them to just feel better about themselves when they're going through a horrific situation, I think is critical. The other thing is patients undergoing medical treatments. One of my favorites are treating people that have just concluded chemotherapy. They have a horrific body image.
Hmm.
Women that have had mastectomies, my wife being one of them. I mean, she was devastated and, emotionally, physically, when you think about it, I mean, these people have a completely different self-image and physically their image has changed. And emotionally, on top of that, it's changed even greater. I remember doing a piece on national TV where we treated her and she talked about it. And, I think it was during Breast Cancer Awareness Month. I think it was the doctors. And it just brought up that as an issue, that it's another one of these things people can do to take a step towards feeling better about themselves. And again, it doesn't need to be a big involved set of treatments, an expensive, set of treatments, but just the very fact that you're taking one little step for yourself is incredibly fulfilling, not only for the patient, but for us as well.
Now, I know you've spoken publicly about your wife and her recovery. I've always admired that you both do that, because I think it helps our audience, it helps your patients realize that, you've had these experiences yourself. You're not just somebody who's talking from a tower. I think that's extremely helpful to people to understand that nobody escapes heartbreak or a situation where they want to feel better. Nobody. And if you can, it's an amazing thing. And you're right. I don't think it's just about the result. I think the fact, it's kind of like when you start a diet, right? For me, I'm always starting a diet. That when I'm deciding to eat better, I feel better immediately because I've
Yeah,
made a decision, or I decide I'm going to start walking more. Before I start that 3 miles a day, I feel better because I've been self-respecting. And I think self-respecting is a lot of what we're talking about.
absolutely. Self-respect is a big deal, and people that aren't feeling good about themselves, know they have a poor self-image and know they're going through a hard time. It's just essential that they look around them and they look for their supports. And pretty much everyone has some support somewhere, or a set of supports, whether that's a family member or a friend or a pastor or anyone out in the environment. There are people to help. There are people there to listen. And, very often that's the first step in feeling better, is just articulating, is letting it go and explaining what you are feeling. So we encourage people that are going through these hard times to be vocal. And sometimes, once they start feeling better about themselves, man, they become vocal. They come back to our office, the first time they came in, they were wearing a long coat. Then they come back, wearing a skirt, and then they just start dressing different, and they're much more verbal with the staff. They're just, they are metamorphosizing as they're feeling better about themselves, within. So it's a really, really satisfying thing to see.
Yeah, it's not just about looking a little bit better or a
No,
lot better. It's a mindset. And I think that's something that people get out of pursuing a cosmetic procedure, invasive or not invasive. Again, it's the holistic experience. It's the whole experience. I hope our audience understands that in talking about this today, this is not about go get Botox or go get a facelift.
no,
This is about we all go through crisis. We all go through difficult times. We all have issues and perceptions of ourselves, and doing something about it that you can do responsibly does change your mindset. It's like, I can't frown. I'm happier. I love that, by the way, that
right.
that
And it was interesting because I called Pat last week. I have a friend that is going right in the midst of going through a divorce
Yep.
and, emotionally hasn't been having an easy time with it. I was asking Pat about, these technical questions about the law and the this and the that and what happens and Pat was sure she answered all those technical questions, and about, took about 5 seconds to answer all those because she's been doing it so long and so well. But then Pat started talking about the emotional part of this,
Right.
of the value that these attorneys serve when they're good and when they're clued in to the patient's feelings.
Well, I think what I
And
said to you is that, knowing the law is one thing. You hope your lawyer knows the law, but you need to understand somebody's emotional complexities. And I don't think it's that different than your work. Obviously, you're skilled technically, obviously, but you need to understand people in order to guide them and to walk them through things. And that is the trick that people sort of don't understand sometimes about choosing a professional, I believe.
right. And this individual, I think that's one of the reasons I called was this individual has an attorney that is giving her advice, and all the advice is legal advice. None of it
Clinical.
is clinical advice.
Right.
It's not regarding what she's going through and how to deal with it, and it's really kind of leaving her with an empty feeling. So I think picking that professional, I think, is equally as important for it to be a good outcome.
There's a lot of skilled lawyers, there's a lot of skilled physicians. The trick is knowing your patient or your client and what's the best outcome for them.
Explain to me, how does a person in need find an attorney who is going to deal with both sides of the equation, both the clinical as well as the legal,
Uh, you
both the
know,
emotional and legal?
Mitch, I think much like when somebody finds you, I think you meet. I always encourage people to meet, and I know it's a little bit expensive, but to meet with more than one person, because if you don't find somebody who has some emotional intelligence, much like in your profession, I think you're going to have a disappointed experience. You assume that the person you select has technical ability or knowledge, in your case, great skill, but you really need to be able to trust that person's judgment or suggestions. And I think you feel it or you don't. A lot of what I do is strategic planning with people, guidance in terms of strategy, because there's 1,000 ways to proceed with a divorce. Just like there's 1,000 ways for people to get little procedures. The
Right.
trick is to match them up and do what's right for them. And I think sometimes, not all professionals, we forget that sometimes that there's a human element to being a professional. And I think that should be first and foremost in our minds once you get to a certain skill level.
So
That's what I think.
can I ask you how, I think our world changed a significant amount when COVID hit, and so many things have become virtual because they are efficient and they do have some benefits. But, I think, at least in our profession, that people that do virtual consultations, sometimes I think you miss something. I think you don't get a true feeling at times about the professional that you are meeting with. It's a little bit of an
Mm.
artificial situation, though I understand the merits of it. I mean, what's your feeling about that?
Well, I think that first I could understand in your world how that would be a little bit difficult, even though you could see your face or you could see the situation. In my world, we give people a choice. Zoom for me has not been as much a barrier that I would have thought it would be.
Mm,
And the reason for that is when I am in a Zoom consultation, I like to think I'm always 100% engaged. but you are right there, eyeball to eyeball with somebody. You are fully engaged. I think it's a little more ideal to have them in the office, but people sometimes are more relaxed when they haven't had to travel for an appointment, sit in an office. They're at home. They're able to talk a little more freely. They can say, excuse me a minute, got to go to the bathroom a minute. They're just a little more relaxed. So I have not found it as challenging in a consultation as I thought it would have been at the beginning of this whole thing.
And the other question I had when people are, I forgot there's other things in patients, when people are unhappy in a marriage, is seeing an attorney sometimes a positive thing before even seeing a counselor? Or is a counselor normally the recommended first step?
You know, Mitch, that's a great question. I think that when people are unhappy in a marriage, many times somebody will say, you better go talk to a lawyer. I think as lawyers, we have an obligation, morally and ethically to some degree, to speak with someone. If divorce is not critical to protecting their legal interests, and there are many times it is and many times it's not, I think we have an obligation to say they should speak with a mental health professional or a counselor. And I think that should be a parallel path. You know, I would say that in 7 or 8 out of every 10 consultations, there's no reason for immediate action. Sometimes there is. There are children being taken. There's money being dissipated. There's businesses being, mishandled. But many times there's no reason to not let people get support from a professional on the outside. So I think whatever you do, you should do them together. I think there's no harm in seeing an attorney to find out, if I get divorced, what's it going to look like? I think the mistake people make, and sometimes lawyers make, not all certainly, is just think that the remedy is to file a complaint for divorce, because there are, I would say, 2 costs to a divorce. There's a financial cost and an emotional cost. And you need to be prepared to spend both of them if you're going to go through that process. And you have to weigh that against the pain or the difficulties you're in now, because people do work out their situations. And many times, there's an old movie. I can't remember. I think it's The Best Years of Our Lives. I can't remember, where there's a line where the daughter says to the mother, you don't understand anything about love. And she says, do you have any idea how many times I've had to fall in love with your father, over and over and over? Sometimes people just have to kind of fall back in love. And sometimes, many times, it's irreparable. But I think it's important for people to understand why they're getting divorced if they're getting divorced. This is something I could go on and on again, and I won't bore our audience or you, but I do think it's not as simple as filing a complaint for divorce.
Right. Thank you.
And you and I have talked about this a little bit, because you see patients who, just like they want the immediate fix of Botox or a procedure, they think a divorce is going to fix it.
Yeah.
But we know that nothing fixes it. It's got to come from the inside. But, I think sometimes you have to learn that. We all have to learn that.
Absolutely.
Sometimes the hard way. But look, you and I could talk about these topics forever. You have been wonderful. I've said this to you as part of our friendship. I am so appreciative that you do take a holistic approach and a kind approach to people. I think it's very important, because I think people are vulnerable when they come to you. They kind of have to admit, I guess I'm not so perfect. So I think the approach you take is one I hope our audience understands. It's not all about not having wrinkles. It's about a lot more than that. And I thank you for taking the time to talk to us about the hope that comes out of many situations, heartbreak and others. So thank you.
And I wanted to thank you for just the way you care for people. We have a lot of mutual friends and clients and patients, and, they just continually talk about how you and your staff of attorneys have changed their lives for the better and supported them through the process. So not only just help them go through the legal process, but really have supported them in such difficult times. So I just wanted to thank you for them as well.
That's very kind, Mitch. I thank you so much. Hey, listeners, don't go just yet. I wanted to let you know that our post-interview chat with Dr. Chasin included some fantastic tidbits. I need to share them. And lucky for me, my wonderful producer, Steph, left the record button on so we can bring you a mini episode this Saturday. Be sure to keep an eye out for this additional content. And as always, thanks for tuning in. Thank you so much for joining us today. Don't forget to follow us on your favorite podcast platform. Please give us a 5-star rating and leave a review so more people can listen in to Heartbreak and Hope with Pat Barbarito.